So I'm going to go ahead and introduce the team for today's topic, which is development of an interprofessional team to improve LGBTIQ plus health education in Texas. We have Dr. Faizan Kabani from the College of Dentistry, Dr. Matthew Kesterke from the College of Dentistry, Andrew Pack, who's one of our students in the College of Medicine, Dr. Alison Pitman, who's in the College of Nursing, and Peter Scaramuzzo, who is also a student in our College of Education. And I'm really excited to introduce them so that they can present their topic. So welcome to our panelists, and I'll let you go right ahead.
Okay, thank you so much to the Office of Interprofessional Education and Research for inviting us, and thank you to all of you for being here. I'm Alison Pitman. Again, I'm with the College of Nursing. I'm a clinical assistant professor, and my personal pronouns are she, her, and hers. I just want to briefly go over our learning objectives for you all for today. We hope that by the end of the session today that you get at least a brief understanding of some of the gaps in care and the disparities that we have with the LGBTIQ plus population and the gaps we have in our educational efforts in the health professions for this population. And we hope that you help us identify some challenges that we all have in developing interprofessional curriculum. And we'll talk about ours with this particular team. And then also we hope that we can all learn ways to form an interprofessional team amongst all the different stakeholders. It was a grassroots effort, and we hope to share some of our findings with you. So I'm going to turn it over to Peter. He's going to talk about some definitions and resources for us.
Peter, you might be on mute.
No, I'm not. I'm still seeing the objective slide. Good morning, everyone.
I'm sorry. My apologies.
There it is. No worries. I'm Scaramuzzo. I identify as a queer cisgender gay man. My pronouns are he, him, his, and my prefix is Mr. To ensure we have a common language moving forward in today's presentation, we will be using the acronym LGBTIQ+, which represents lesbian, gay, bisexual, transgender, intersex, queer, and questioning folks. This acronym is by no means all-inclusive, and it is often used as an umbrella term. In our efforts to be inclusive and representing the beautiful array of lived experiences and identities within our sexual and gender diverse community, including queer folks, gender fluid folks, gender diverse folks, non-living with HIV and AIDS, as well as to recognize our allies. We choose to include a plus here to recognize and honor all of our voices. We recognize that folks have multiple intersecting as well that can and do shift over time. As we proceed, it is important for us to remember that language is a powerful and imperfect tool. As we strive toward inclusive use in our work, and in order to avoid unintentional pathologization, regulation, and othering of folks, we never intend to distance the whole person from their expressed representing identity or identities. So ever-evolving gender diverse and sexual diverse terms used to represent and express folks' identities and lived experiences, we encourage you to visit the fantastic Texas A&M University Pride Center or the National LGBT Health Center. And to begin learning about the critical importance of correct pronoun use, please visit Pronouns Matter. If interested, this slide will be available with active links following today's presentation. Next slide, please.
Great, thank you, Peter. This is Alison again. Next, we want to just kind of go over sort of the state of the science in terms of health with our population. The Institute of Medicine came out with a large report in 2011 that really outlined sort of the state of the science that that LGBTQ folks really have some unique health disparities, and it really acknowledged, based on some systematic research, that there's a lack of knowledge about their needs amongst all health providers. There's also a lot of intersectionality. We can't ignore the fact that a lot of disparities overlap. So a lot of folks also suffer disparities because of race, ethnicity, socioeconomic status, where they live, particularly rural populations, and their age. And the report also stated that there's a lot more data and research that is needed. Next slide, please. This is just a sort of an infographic to outline the disparities. And, you know, Jasmine, I know you mentioned that you're wanting to learn a lot about these towards your work with students and people on campus, and I'm sure there are other people as well. So based on the IOM report, this is just something that we put together just to outline some of those factors and just real briefly to highlight some important things. A lot of people who identify as LGBTIQ have experienced so many negative experiences when seeking healthcare that they just don't seek healthcare. And that's particularly important today in our current pandemic crisis, that people would hesitate to seek care because of the discrimination that they have been experiencing prior to now. There's also a lot of societal health issues. There's increased rates, unfortunately, of things like cancer and obesity, again, because of a lot of the intersectionality that we've talked about. And of course, interprofessional violence, bullying, particularly in adolescence in school. LGBTIQ folks are more likely to be homeless, more likely to suffer from abuse of alcohol, substance abuse, and are again delaying seeking treatment. And so you can see even across the lifespan, there are particularly vulnerable populations, and we have a lot of lack of meaningful data. We really need a lot more funding opportunities that can fund research in these areas. And I just want to close this particular discussion by saying there's a lot of new research out there that talks about some of the positive aspects. We know that this population and all humans really are very resilient. And so we're also asking for more funding and research on the resiliency and the positive aspects of people who were sort of outside the box and are positive deviants in terms of seeking healthcare and improving health for this population. Okay, next slide, please. Dr. Kabani is going to talk about our overall problem statement and why we came together.
Thank you, Dr. Pitman. Hello, everyone. My name is Dr. Faizan Kabani, and I am an assistant professor in the Curricula School of Dental Hygiene at Texas A&M College of Dentistry. And my personal pronouns are he, him, his, and himself. The problem statement, or as I like to refer to as the imperfect status quo, is that each of our individual professional organizations, including the American Dental Education Association, the American Medical Association, American Nurses Association, American Public Health Association, and American Pharmacists Association, all agree that advanced effort and research is needed around LGBTIQ+ health education. However, these are all siloed and discipline-specific recommendations. As we are all aware, in an increasingly diverse world, quality patient care is dependent upon practitioners being able to provide culturally and clinically competent care to all patients, including LGBTIQ+ patients. Unfortunately, the status quo is that there are no institutions in Texas that provide an interprofessional LGBTIQ+ curriculum, which leaves healthcare providers and students with limited training, knowledge, and experiences in caring for LGBTIQ+ patients. Our broader goal as Aggie's leading the way is to develop a TAMU Center for LGBTIQ health education and to build the first interprofessional LGBTIQ+ health curriculum in Texas. We hope that this endeavor serves as a beacon of hope and light that paves the way for improving knowledge, attitude, and skills of our diverse healthcare providers in providing culturally competent care to LGBTIQ+ patients. Next, we will have our student members, Peter and Andrew, overview the case study, which highlights the journey that brought our team together.
Andrew, you're on mute.
Sorry about that.
Nope,
I think
you're good now.
to start, I believe Dr. Pitman is going to discuss the open call that she made for our different departments at the college, at the Health Science Center.
Sure, I'm happy to do that. So we really I noticed a lot of just in discussion, and it was really an event that was put forward by our College of Medicine organization, MedPride, that we really don't have a lot of curriculum across our colleges that addresses the disparities with our population. And so put forth sort of a call out to deans and deans of offices of diversity, whom are on the Zoom today. I saw Dr. Holyfield, and so it's great to see y'all here today. Just asking for their help in recruiting faculty and staff who were interested in sort of exploring the effort. And so everyone who responded volunteered their time with us, really get work. Students don't course credit for what we're doing as a team. They're really doing it in their own extra time because of their commitment to the project. And so I'll let Peter and Andrew talk about how they sought out being part of the team.
Yeah, so something that I think was a valuable way that Dr. Pitman and the initial starting and inaugural team started this effort was through advertising the effort and being interviewed by Texas A&M Today. As a student who was coming to the university not from Bryan College Station and having no connection to the community, to have information about this through word of mouth, through seeing that advertisement, I was able to reach out to Dr. Pitman and see what type of ways that I can contribute, and that's the way that I got involved.
Yes, and I apologize if my audio is not consistent. It's a Zoom world. I don't know what else to say. I became involved because for several semesters I was giving lectures to pre-service healthcare professionals and pre-service medical professionals in the College of Health. What is the actual college name again? HLTH, here on campus. And I was lecturing on the diversity of gender and sexuality to these future healthcare professionals, and providing them with a crash course, as it were, in a wealth of information for many they had never encountered before. As of that, I had a conversation with Frankie Jackson over at the Pride Center, as well as some other folks over at the Pride Center, and they connected me to the work of Dr. Pitman, and that's how I came to be involved in this project.
Since we came together, the initial starting initiative started in March, and the meetings have changed from being monthly to more frequently at different times when different efforts were needed. But something that's really exciting about our team and how we came together was there was an opportunity from faculty as well as staff who are working in different departments, including the College of Medicine, Nursing, Pharmacy, School of Public Health, Dentistry, the CLRC, and as well as the College of Education, to come together. And that was really exciting. And then also that there was an opportunity for student voices like Peter and I to be able to contribute and share what we could in terms of gaining experience as well as contributing to the work. So that was something that was really an opportunity for us to develop as well as to have an opportunity to contribute. And then next slide.
So
you're muted.
I can. Uh-oh.
We can hear you, Alison.
Can you hear me okay?
Yes.
Okay, great. So just to mention some of the challenges, we are all trying to put this effort together in addition to being full-time students, full-time jobs. And so time and money is an effort. We have applied for several funding and have not been successful yet, but we're still trying. And so the monthly Zooms are really the time that we come together to try to efforts. And we're of grant writing and proposals and things like that in our extra time. We're also working with a lack of data. When we go into the literature and look at what's out there in terms of across all the different health professions, there's just not a lot out there about best practices. And so we're even, Dr. Alonzo, one of our team members, is putting together clinical guidelines, almost from scratch based on what we can find in the literature and what we can find in terms of best practices. So there really is a need for more evidence in these areas. Another thing to consider is, individual human experiences are not uniform. Two people who identify the same are not going to have the same experiences, and so you can't say everyone needs to be treated by everyone you encounter needs to have this approach. And so we really need to focus on each individual human when we teach our providers about care. And again, as I mentioned before, a lot of the research out there focuses on experiences, and we also focus on the review of humans and experiences with health that our target population provides. So one of the things we have found in our literature review is that interprofessional studies find average health profession student anywhere from 0 hours, in LGBTIQ plus health, 5 hours. And we've included a few references. There's just not a lot out there. One of the things we did, we investigated our own interprofessional student, and we found that in Texas nursing health get about 2 hours. Our College of Medicine across their entire curriculum gets 4 hours. Dentistry and nursing get between 5 and 6 hours. And in pharmacy and public health, there are a lot of courses that include LGBTIQ plus content, but nothing really standard across the curriculum. And College of Pharmacy has developed some clinician guidelines that they show students to use in practice. So that just summarizes what we found within our health science center and what we see across the nation. So next slide, please. Dr. Kesterke is going to talk about how our mission is shared with our institutions.
Thanks, Alison. I'm Dr. Matt Kesterke up at Texas A&M College of Dentistry in Dallas. My pronouns are he, him, and his. I think it's important when we look at a shared mission for our group to kind of go to the Texas A&M University mission statement, which, to paraphrase, says that Texas A&M is dedicated to the discovery, development, communication, and application of knowledge to serve persons of all racial, ethnic, and geographic groups as it addresses the needs of an increasingly diverse population. In reviewing that, we see that there's a lot of intersection and shared mission statements across a number of organizations, beginning at Texas A&M. We have the LGBTQ plus Pride Center, Aggie Allies, as well as other programs that all have individual mission statements, including OSTEM, Transcend, Student Health Services, and others. Then within Texas A&M and health itself, one of the main offices we have, and how I got included on the project, was the TAMU Health Diversity Leadership Committee, with members from all 5 schools, including Dr. Hollyfield, who's on this Zoom meeting, and diversity and inclusion initiatives here at the various health profession schools. Finally, we also have a lot of intersection and overlap with the Office of Interprofessional Education Research, IPER, in a goal of transformative learning experiences. Our team brings together this intersectionality also with the professional organizations that Dr. Kabani had mentioned earlier. So this shared mission is to sort of develop, as mentioned, an interprofessional curriculum. Next slide, please. So moving on from here, where do we go next? Our first primary concept and goal is starting a survey to both faculty and students to identify current existing education and perhaps gaps in LGBTIQ plus health education. This could be both to identify curriculum as well as some of the hidden curriculum or unidentified takeaways that some of our students receive across different curriculum. We hope to move towards focus groups and for both student, faculty, and staff, is including simulations to kind of develop a mutual ownership and expertise from the multiple areas represented on the grant. We'd also like to establish an IPE curriculum development within the schools and across the schools, and with the end sum being sort of the establishment of the first center for LGBTIQ plus health education for Texas and representing all of Texas in the schools there involved. Go to the next slide, please.
Thank you, Dr. Kesterke. As we all can see, our group is a dynamic interprofessional team comprised of faculty, staff, and students across Texas A&M Health and the broader university. We have, through the support of our deans, team members from the College of Pharmacy, College of Dentistry, College of Nursing, College of Medicine, School of Public Health, and the College of Education. Our fearless leader, Dr. Pitman, has been instrumental in keeping the team energized, engaged, and effective in making a difference. Thank you, Dr. Pitman, for your leadership. Lastly, at this point of the presentation, we will transition to a section reserved for group discussion before we conclude with final recommendations. What questions and/or comments do you all have that we can engage in with the group? Please feel welcome to either verbalize or enter your question in the chat.
Hi, this is Heather Zimmerman. I'm with the Oral and Maxillofacial Surgery Residency Program at the College of Dentistry. I also worked in ACGME accreditation with an OBGYN program at Baylor University Medical Center in Dallas. And when I was at a national training event, they had a similar session to this. And it was surprising to learn how many people, OBGYNs, in professional practice, students, program directors, that didn't know that EHRs have plugins for labs and stuff like that. So the first picture in the slide deck was that of a pregnant man. And I think so many people don't realize that there are people in hormone therapy and other stuff like that. So what have you all experienced in EHRs that have the capability to document for an LGBTQ patient?
Anyone from the presentation team?
Yeah, this is Matt Kesterke. Hi, Heather. It's good to see you. In the sort of lack of research and literature out there, we do see sort of a general, what we call basic understanding of some of these things when we screen patients, knowing whether or not they're on hormone therapy or gender affirming surgery processes are often just overlooked, not out of a willful disregard, but a sort of a lack of general understanding of definitions and terms. And Peter had mentioned it. He teaches courses on just, as he put it, a crash course in pronouns and use and addressing. And I think hopefully what can come from some of these is just the willingness and safety of both clinicians and patients to be able to openly communicate and ask questions, I think, is often the first. But you don't see, and a lot of the research seems to focus on the back end of what are the most extreme cases that we could really either, if you read some of the medical literature, that we could really mess up as clinicians, when maybe we should start identifying some of the very early, easier, it's okay to ask questions steps.
We have a question from Shelly White-Corey. Shelly, you want to ask your question?
Sure. Thank you for your presentation. This was really enlightening and also inspiring. Y'all are pioneers, and I appreciate the work that you're doing. It's incredible. And I just want to hear so much more. I have a ton of questions. But in our OB course, we have a simulation. It's on an obstetric emergency, but we've included in there a lesbian couple as the parents of the baby. And, you know, students roll with it. They don't seem to have any, it doesn't seem to trip them up at all. But I was wondering if you have any plans for your curriculum to implement this in a simulated case.
We do, definitely. Dr. Kraft is mentioning, and Andrew Pack is part of the group that puts forth this simulation. He if you want to speak to it, it's voluntary. It was out of everyone's own time. It's not part of a required curriculum, but it's just a great introduction that introduces what a LGBTIQ plus welcoming waiting room and exam room environment looks like versus a non-welcoming. So it at least introduces all health professions to how to improve the way our environment looks. We also have some simulations within the College of Nursing in the pediatric course that I teach, where there is a adolescent that is gender questioning right now and trying to find their identity, and the students are asked to think about their communication, at least introduce them to communicating with an adolescent that's having that issue. Any other colleges want to comment on any simulation that they're doing? Our goal really is to have a simulation that's interprofessional, where we have standardized patients come. And I recently went to a similar event at the University of Louisville, which has a great graduate certificate program, where they had standardized patients that came in, and we had to practice doing an intake interview with them. And that was really eye-opening to, we had professions from all over. And so that's something that we are looking into including into our interprofessional curriculum for the Health Science Center.
Perhaps somebody from medicine would like to elaborate a little bit on the simulation that they did?
Sure. So I was not part of the initial team that did the simulation. The initial team was with Farhan Mathani and the student team and professors that he worked with. But the model is for him to give a visual and experiential educational experience, where people will go into different waiting rooms and see what specific elements there were between these two waiting rooms that would make one more welcoming to an LGBTQIA plus patient versus a non-LGBTQI plus patient. And as well as having some type of evaluation of what change in attitudes, what change in learning experience happened during that learning experience. That was done a few years ago. And right now, Farhan Mathani, from what I understood, it happened a few years ago. Farhan Mathani is a student who's taking charge of that, as well as Dr. Pitman is being the supervising PI in terms of making sure that the way that we conduct it will be measuring correct variables and making sure that this experience is building upon the experience from a couple of years ago.
Can I say? Yeah, let me say something too, because I was a little involved in that. I'm the faculty advisor for Med Pride, which is the LGBTQI medical student group.
Yeah, Dr. Kraft as well. Sorry about that.
And no, that's okay. And this was actually an interprofessional project, in that both nursing and medical students were very much encouraged to go through the waiting rooms, and they were open for, I think it was half a day, maybe not a full day, but a number of people did come through, and faculty did also. And I know there are also ongoing discussions with the CLRC to include more LGBT content in all of the standardized patients exercises that they do, and our students do a good number of them.
What other questions do our participants have? You can either speak up, raise your hand, or perhaps put it in the chat as a question.
What was the question?
I was asking if there were any other questions that our participants had for the group.
Well, I have one. I have a ton, actually. But I was curious, you mentioned, Dr. Pitman, that you haven't been able to secure any grant funding so far for your work. Do you have any idea why?
Well, a couple of different things. I can see Dr. Kraft smirking. There's really not a lot of funding that is specifically for research in this population. You really have to look at private donors rather than, but for a lot of reasons. We have really tried to seek both intramural and intermural funds. And a lot of it we realized is we need some more hard data. You know, if you want to get a pilot project going, you kind of need to have some interim data. And so we're really focusing the survey that Dr. Kesterke mentioned, where we're going to survey our faculty and staff on their their educational needs and their education so far, and sort of present that data as a pilot project in order to get more funding. So there's several different challenges, but I think, so in chat we're talking about how can you get data without funding? How can you get funding without data? It's that eternal struggle. But we're just trying to find the right fit. When you're competing for intramural funding within a large university, you're competing against so many other projects, and so there's a lot of different factors there. But those are some. And if anyone else has any that they want to add, I'm sure there are other things. Oh, we've got some great funding suggestions too. Thank you, Brandon.
I would just add to what Dr. Pitman was mentioning earlier about how this is really a lot of passion-filled effort, voluntary effort across Texas A&M Health, faculty, staff, and students to try to put in enough time and energy towards the survey as a way to kind of get some preliminary data that will hopefully serve as a springboard to getting some funding, whether it's intramural or extramural. So we, would appreciate and invite any, and in the beginning of the presentation, we made a specific mention towards the plus part, where this is allies, these are champions. And so, all of these individuals that are joining us on this call can potentially and are serving in this champion and advocate and role. And so if the team, if anybody on the call would like to be a part of the team or help advance the effort, we look forward to welcoming you and making this a more stronger movement.
Hi, I'm Amy Boyd. I'm with occupational therapy at the University of Mary Hardin-Baylor in Belton, Texas. We're actually a Christian university. So I feel like this is really needed for our healthcare students for a number of reasons. But I had a couple questions. One is, I'm not familiar with TAMU. Do you have OT, PT, speech?
We do not.
Okay.
Yeah, we have a lot of pre-OT.
I think that was Alison. You were breaking up.
Yeah.
It was Dr. Kraft. I think she, it's okay. I think she's trying to say that we have a lot of pre-therapy programs that prepare students to move to a different institution that has that. Yeah.
Okay, awesome. And then I was also just going to say too, and Dr. Kabani kind of mentioned it, but we would love to be a part of the survey, maybe just for faculty at least. A lot of our programs are new, so the students haven't gone through the whole curriculum yet. But we're doing a lot of curriculum development within our IPE committee, and I think this is an important thing that we shouldn't kind of push to the side. So we would be happy to help out.
I'm so glad that you say that, because really our goal is to assess our institution first, and then because we want to serve the entire state, our next leg would be to survey faculty and students across the state in health institutions. So great, thank you.
Other questions? I see that Shelly had another question about whether the presenters foresee this becoming a credentialing requirement down the road.
Can I say something?
Mm-hmm.
I would love that to be the case.
Diane, you're breaking
I would love that to be the case. I think part of the issue, oh, I'm sorry. I don't know what to do. I think part of the issue is that we're still experiencing, I think this might be related to the funding issue, is I still think there are many people that do not consider this a legitimate avenue to pursue. And I would love to see it as a credentialing requirement as part of special populations for medical students and for all health students. But I don't think it's going to happen anytime real soon.
Hey, can I also jump in with a comment? So my role as a sort of the non-medical from the College of Education, I see my role sort of in two different ways. One is sort of in a curricular, pedagogical design, right? So like my role will be to sort of assess the construction of the actual curriculum when it gets to that point. And I think my second role, given my background, is sort of from a social science perspective. So sort of bringing up different sociological, sociopolitical, and sociocultural issues that contribute to the design of something like a curriculum like this for LGBTIQ plus folks. So when I hear, so I'm oftentimes thinking in different sort of intersectional layers. So when I hear the word credentialing, I think that's great on the one hand, and on the other hand, what does that exactly mean? And what does it take for one to become credentialed, right? So the idea being, I think back to when safe zones in schools, in K-12 schools was a thing. I don't know if it would text on New York, but or in universities, you saw ally stickers or safe zone stickers everywhere. And in some contexts, the way one attained that sticker was going to like an hour or 2 hour workshop and then walking away being called an expert in providing a safe space for students. And I always found that really problematic. Not in all contexts, right? Sometimes there were like a series of workshops that someone would have to go to get that sticker. And then in some cases, someone saw the sticker and said, ooh, I want one too, give me, and they got it, right? And so that's really problematic. So when we talk about credentialing pre-service healthcare professional, idea that they are properly prepared to service LGBTIQ plus folks, we have to really ask ourselves what that means and what that looks like, and does having that accreditation mean that they are truly prepared, right? And so like there are all kinds of questions that I think are unique to the design of a curriculum like this that don't necessarily fall in other curricula that are designed for pre-service healthcare professionals, if that makes sense.
One of the things we've discussed is creating sort of thank you, Peter, a postgraduate certificate that's applicable to any health profession. But I think, like Dr. Kraft said, that's something that's going to take a while to develop. We need to kind of try it out with our own students first, and then hopefully we would really love to open it up to to providers that are already out in practice, that sort of like as a continuing education effort.
And I would add, and there's a growing force with this adoption, but a lot of individuals who are allies are also including pronouns and links to why pronouns matter as part of their digital signatures. So there are a variety of ways in which we can all champion for and advocate, ally for, and this is just one endeavor.
And I'm noticing in the comments in the chat that there are, we're pointing out a number of links that are as part of the presentation that we'll be sending out, but also some additional online resources that people can go to learn more about terminology, related terminology and vocabulary. Other questions?
Chris, can you see me?
I can hear you.
Okay. I'm sorry. I've been talking too much today. Have you thought about maybe an elective course that could be taken with students? For instance, in the College of Medicine, we have the EDHP. That certainly could be a course that students could choose to take if you set it up teaching. You know, what would be the differences and what would be the nuances that you might consider when teaching students who are LGBTI. That might be a thought as well.
So a course for faculty, is that what?
Well, in the EDHP is a master's course for health professionals. So they're all health professionals in that program, and they can elect to take, I mean, we have electives that they can choose from. So that might just end up as an elective that they could choose to take. It would not be necessarily required at this point, but maybe you start it as an elective, and then as it grows, there might be programs that would want to make that into a required course.
That's a great idea. I like it.
If I can just tag on to that, as I was sitting here listening, I did just contact you by email, Alison. We are having an interprofessional curriculum summit for developing courses just like that, and I sent you a notice about it, so hopefully you will be able to join us for this next meeting. And that also leads into a question that was also in the chat, which is, you know, what is your timeline for curriculum development? What do you foresee that being like?
I think we really want to wait until we get the survey results from our students and faculty and see, you know, how big our gap is and what the needs are, the educational needs are. And I think that will sort of guide our timeline. We really are trying to push this forward more rapidly. It is hard to develop, you know, a full curriculum, and there are some existing curriculums out there. So we want to see, based on the educational needs in the survey, whether existing curriculum, you know, can be adopted. We don't have to reinvent the wheel, or we can supplement it. So I think once we get our survey results back, we'll be able to answer that. But, you know, we want to move forward as quickly as possible, if that makes sense.
Sure. So Alison, another thought that I just had, if your team wants to consider an ECHO project, which is what we're doing today, that we could do across Texas, across the United States, as far as speeches you would like to have, but doing once a month presentations about different topics that your committee is interested in or concerned about, or you could get other speakers to do the presentations, or you all could do them yourself. Looks like you have a really nice large team that might consider doing that. So I would love to talk with you about that if that's of interest to you.
Great, thank you.
So why don't we move on to final recommendations, because we're coming close to the end of our time together.
Sure. So for other, we've talked a lot about what we're trying to do with, and we're still developing really. And so if there are any other educators, health providers, community members, anyone who is considering how they might incorporate this into your own practice, I think the first step for anyone is to really assess your own knowledge, your own skills and attitudes on treating folks that are LGBTIQ+, and really assessing what your thoughts and feelings are about how to approach these health issues and help the population within whichever profession you are in. And then secondly, sort of assess what curriculum exists within your program. Sort of look at the different courses, the different curriculum within the program where you are. Where are these health issues addressed? What are the needs of your students and faculty? That's what the survey that we're currently developing is going to do. What do students feel like they need? What are, based on what they've been taught so far, what has been helpful, what is missing, and also with our faculty, what are their needs, and compare that with any evidence that's out there. And then lastly, how can I contribute? How can I, looking at what you see in terms of the disparities in healthcare in this population, how can I help close that gap and provide better care within the profession that I serve? Any other team members that have other recommendations, they're certainly welcome.
I think the strength of our team in particular is just the array of voices represented from different colleges, as well as at different journeys in their academic careers. So as a grad student, I'm very fortunate to be a part of this team, both in terms of learning, right? I'm learning how to be a part of a collaborative interprofessional team in the process, but also because I feel like my voice is valued, and because I am recognized for the expertise or the knowledge I can bring to the table. I think what makes this team so dynamic and awesome to work with is because I think historically, when numbers of LGBTIQ plus folks, it's often very clinical. It's often very cold, and there is a long history of it being pathologized. So bringing in folks from different colleges, from different viewpoints, I think can mitigate some of that, right? You have a great group of folks who are passionate about this. We're not being paid, and that also helps to mitigate some of that, I think.
And I'm sorry, I feel like I'm talking a lot, but one thing is we don't always agree. When we have Zooms and we're discussing approaches and what our priorities are, we don't always agree, but we really are realizing more and more that the diversity of our group is one of the keys and why it works so successfully. And I, for one, really look forward to our collaborations, because I learned so much from all the different perspectives. Absolutely. And so, one important thing that I think is important, whether you're teaching or whether you're collaborating, is to really set some ground rules in terms of what we want it to put forward in terms of respectful communication, respectful disagreement, how you're going to handle divisiveness within a group. And, fortunately, without really having to put forth a lot of ground rules, we've really been able to do that successfully. I think that's just my opinion. I don't know how the rest of the team feels.
I think that one of the important points that I'm sure we all can relate to is, in an increasingly diverse world where we are engaging and interacting with people who may be different from us, different backgrounds, different perspectives, it is an even more important part of today's efforts to be inclusive, to have a pluralistic outlook. And so this team and what we symbolize and what we hope to achieve goes well beyond the walls of Texas A&M. And the cosmopolitan ethic that we hope to inspire for future generations to come, hope to leave an imprint that will last for years, that will hopefully make a difference in the lives and in the quality of life of patients who identify in the LGBTIQ population, as well as in the allies. And we hope that you continue to support inclusiveness within your own local context and call for it in the broader context.
Well, I want to thank the presenters for sharing this information. They did an amazing job. I appreciated learning the content and hearing more about their efforts. We're going to close up our session now. But first, I want to make sure that those that are still on the call know about a couple of additional webinars that are coming up through Project ECHO. We have one tomorrow at 12:30, Rounding Out IPE, which looks at medical and pharmacies collaboration in interprofessional rounds. And then we also have one on Thursday at noon, which is Bridging the Gap Between Dentistry and Nutrition, looking at bringing students in dental hygiene, dentistry, and dietetic interns together. So please do join us for those. And then I just want to say thank you to everyone for participating. If you want further information, you can go ahead and contact Dr. Alison Pitman about the LGBTIQ+ curriculum. If you have any questions about Project ECHO, you can contact Dr. Regina Beard. And if you have any questions about the Office of Interprofessional Education and Research at Texas A&M, you can contact me. We will be sending out a very brief survey. I promise it's brief, just a few questions, so you can help us improve our efforts. Again, thank you for joining us. And what I would do now is invite the presenters and the ECHO staff to stay on the call and bid everybody else a good afternoon as they move on to the next part of their day. Thank you.